Hello, my name is Sultan Al-Mutairi, PhD student candidate in Lincoln University College. Today I will present the topic, the effect of safety culture framework on reducing medication administration error, a systematic medication administration error as preventable events occurring during drug delivery. And safety culture models offers promising framework for breaking down these challenges. Efforts to reduce medication administration error in Saudi healthcare system remain fragmented and often reactive. Nurses frequently report challenges such as unclear protocol, limited managerial support, insufficient staffing training, and fear of disciplinary action when error occurs. Aim of the review to synthesize and evaluate quantitative evidence on the efficacy of the models of safety culture in the prevention of medication administration error in Saudi hospitals. Attempts to establish the lived experience, attitude, and practice of nurses and health professionals related to medication safety and organizational culture. The research question is how does the implementation of safety culture framework affect the reduction of medication administration error in Saudi Arabian hospitals? The broad objective to systematically explore how the implementation of safety culture frameworks influence the reduction of medication administration errors in hospital across Saudi Arabia. The specific objective is to identify the common themes and experience related to safety cultures and medication error among Saudi Arabian healthcare professionals, and to explore the perceived quality of safety culture practice and reducing medication administration error, and to explore the factors influencing the effective implementation of safety culture framework in the hospital setting in Saudi Arabia, and to provide evidence-based recommendation to healthcare organizations and policymakers for improving safety culture and medication administration practice. As the Kingdom of Saudi Arabia is determined to develop the healthcare sector's patient safety and the quality of healthcare must be ensured under Vision 2030. The analysis can be utilized in a hospital policy and training curriculum and leadership practice. For the methods, the systematic review utilized the PRISMA 2020 to enhance transparency and reportability. The review utilized the PICOS framework to drive inclusion and exclusion criteria. The inclusion criteria will be to the healthcare professionals and will include the qualitative studies published between 2015 and 2025. For the exclusion criteria, it will be studies conducted outside the Saudi Arabia, quantitative or mixed method studies, review articles, editor, commentaries or thesis, non-English publication. For the data collection and synthesis, a narrative thematic synthesis was preferred because the setting and study methods were heterogeneous. We used a GPI critical appraisal checklist, moderate to high quality studies. For the result, a systematic literature search was conducted in 6 major databases: PubMed, CINAHL, and Scopus, Web of Science, Saudi Digital Library, and Google Scholar, with manual searching of reference listed. 5 themes were identified through thematic analysis based on 8 qualitative studies. Fear of blame and punitive consequence prevented nurses from reporting errors, especially younger and expat staff. A participant noted that making an error often left like a moral failure, leading to shame and isolation, such as stigma fosters silence and missed opportunities for learning. Communication issues during handover were directly linked to medication administration error. Errors stemmed from missing or unclear documentation during nurses to nurse or physician to nurse transition. Junior nurses and pharmacists expressed discomfort when questioning physician or senior staff on suspected or potential medication error. These interactions were often perceived as confrontational or disrespectful within rigid hospital hierarchies. Transformational leadership helps reducing error by building team trust and encouraging safety huddle. In contrast, disengagement or authoritarian leadership lead to fewer reports and more staff disengagement. Staff shortage and excessive workload were strongly linked to increased medication error in all studies. Many nurses admitted to prioritizing speed over accuracy when patient ratios were too high. Some nurses admitted they had never received formal training on reporting system. In contrast, where safety training was provided, staff felt more confident in preventing and reporting errors. The most common finding was the prevalence of blame culture, which discouraged error reporting. Poor communication was another root cause of medication error, especially among junior staff who feared confronting physicians. Leadership style played a key role in creating a positive safety culture. Transformational leaders encouraged reporting, while punitive leaders caused silence and disengagement. All studies emphasize that insufficient staffing and high workload were major risk factors for medication error. Lack of regular training on medication safety was a major gap, which aligned with the WHO recommendations. This review only included qualitative studies from Saudi Arabia, so generalizability is limited. Also, thematic synthesis is interpretive and may include research bias. The review was aimed systematically at exploring the impact of adoption safety culture models on reducing medication administration error in Saudi Arabian hospital. The review shows the safety culture models, when positively encouraged by leadership, can enhance safer practice. This systematic review confirms the multifactorial risk of drug administration errors and highlights the central function of safety culture models in avoiding. To improve medication safety, this review recommends implementing non-punitive and confidential error reporting system. Transformational leadership should be promoted to build trust, empathy, and team engagement. Standardized handover process, such as a SPAR, can minimize communication error. In addition, safe nurse-to-patient ratio and ongoing training are essential to reduce workload, pressure, and support staff competency. These actions can help create a strong safety culture aligned with the Saudi Vision 2030. Future research should include the long-term and mixed method studies to evaluate the effectiveness of safety culture intervention. Comparative study between public and private hospitals in Saudi Arabia can help identify institutional factors. Also, exploring patient opinion may offer valuable insight into how safety culture affects care quality and trust. Thank you.